Our first topic today is going to be COVID and how it's impacted people in poverty. Earlier, Kenny announced his plans to help reopen the province. He announced quite some time ago that it'd be in 3 phases, and he announced that this week we are going to be entering the second stage of reopening the province. And this got me thinking as to the general thoughts on COVID and how it's impacted people living in poverty. And I think a lot of people tend to forget how COVID-19 has impacted people in poverty. It's often not part of a lot of the discussions I've been in. There's discussions about making sure that kids still have an adequate access to education, to students having their convocation, to when our hairdresser is going to be allowed to cut hair again. And I think those are all very important issues, especially because a lot of people who are in poverty are essential workers, but there are also a lot of people in poverty who have been either furloughed or had their positions temporarily eliminated as a response to the pandemic. In particular, waiters and waitresses at dine-in restaurants, as well as the aforementioned hairdressers. So I do believe that there is an importance in getting people back to work. But let's talk about the pandemic in general and how it's impacted people in poverty. We've already discussed, of course, the loss of labor for many low-income workers. But there's also been a closure of a lot of services that people in poverty rely on. Some have done an excellent job of trying to remain open. The food bank closed down for a couple of days, and that sent a few people into a panic because we weren't sure how long they were going to stay closed. But within 48 hours, they were up and running again, and had Alberta Health Services come in and make sure that they were doing everything they can. So kudos to the Calgary Food Bank on that. But there are many mental health live-in programs that people, especially people who are coming off the streets and moving into program housing, their programs aren't operating right now. And this isn't just specific to one particular program. I don't have a full exhaustive list in front of me, but many residential programming at housing that offered such programming has been scaled back. So, and I want to be clear, I'm not talking about, say, Alberta Health Services buildings that require 24-hour nursing or supervision. That has still been going on. But caseworkers, our resident caseworkers have been scaled back. And case management has been had to move online where possible. And so this has made it fairly difficult for a lot of tenants, especially people with mental health issues. There are some things that I'm still trying to learn. How does someone who is homeless see a doctor at CUPS? Many CUPS clients have been able to have meetings with their doctor over the phone or on Zoom. But how does someone who doesn't have a smartphone do a Zoom meeting? And people who might not know how that kind of technology works, how do they call into that? How do they learn? Who's there to help teach them these things? And so there's been a lot of meal programs have been cut as well. Some meal programs have been able to operate through out front, not coming inside. Others have been completely suspended. There's a lot of places that have been working with Cobb's Bread to help distribute bread to the community. and that's had to been scaled back and in some places temporarily closed. And keep in mind that at the same time that the toilet paper and hand sanitizer and Sani wipe shortages were beginning in mid-March, retailers were selling out of bread. So even people who weren't in poverty were relying on some of these bread programs to get access to just such a basic, common staple. Calgary Transit as well. There's been impacts on Calgary Transit and public transportation. I myself can tell you that my fare entry expired during the pandemic. So now I've got to reapply for fare entry, and I've got to be able to manage to figure out the time to go down and do that, and have the bus fare to go downtown and do that. So it's been a whole bunch of small things. And I'm not saying that it's like everyone is out to get people in poverty. Just in the broad picture, in the big picture, the individual organizations are doing everything that they can. And I appreciate every little bit that they are trying to do, whether it's moving meetings online to accepting referrals by text. Services have been doing what they can to adapt, but there are still gaps. And between transit-related issues to the inability to get masks, many stores have implemented mask policies. And, well, if I can't go to that store because I don't have a mask, but I can't find a mask anywhere, or to order a mask online costs too much money, then that means that I have to either go to a store farther away, or I have to then hit up multiple stores until I can find one that lets me in, or I have to order groceries online. And ordering groceries online is pretty expensive. So now we have people who are in poverty who are spending more money on food because some of the services that they relied on aren't in operation right now, or have scaled back their operations to the point where this person's just outside of the capacity that they can serve. And then they have to order their groceries online, or they have to spend 8 hours on public transit traveling to a whole bunch of different stores to find some of the things that they need that are sold out. And it becomes a case of death by 1,000 cuts. It's not that there's any one big thing impacting people in poverty. And any one of these things by itself, if everything else were to stay normal, would be perfect. But instead, it's a case of a death by 1,000 cuts. And this has greatly impacted the lives of people who are in poverty. And that's just the physical and financial aspect. The mental health aspect of social isolation is huge. People who are in poverty, we have trauma. We're resilient, so to speak, but we're resilient because we don't have a say in the matter. And so when it comes to making sure that our mental health is met, there's a huge shortfall in there as well, because, well, we can talk to crisis counselors, we can talk to therapists as much as we want within our budget. There's still something where you just cannot replace actual face-to-face interaction. And all of the therapy and all of the mental health workers and all of the crisis center calls cannot replace that. And so I think when everything is said and done, we're going to need to take a huge look at how this pandemic has impacted people in poverty. We are going to need to study it. We are going to need to learn from these shortcomings, because we're going to need to make sure that we have a plan going forward. Not just in terms of a pandemic specifically, but in a natural disaster. How do we make sure that these needs are being met? So I think in the end, this is a great learning opportunity. And I hope that the province, the city, the federal government, that and even just communities at the neighborhood level, that we can learn how to support our low-income citizens better in a crisis that affects everyone.